morning, good afternoon, or good evening, and welcome back to Bariatrics and Beyond, the podcast where we talk about life before, during, and beyond bariatric surgery. So, beyond bariatric surgery would be plastic surgery. You guys are going wild over plastic surgery. So, today we have a very special guest, our extremely talented plastic surgeon, all the way from Tijuana, Mexico, Dr. Rios.
Thank you very much for the introduction. How are you doing, Kayla?
Good. I'm doing fantastic. How are you?
Great, great. Finishing up with today's work, surgery consultations, and taking some time just to see what we can talk about today.
Great, because we do have a lot of questions, but let's just start from the very beginning. Um, let's introduce you, who you are, where are you from, and all that fun stuff. How long have you been with EOC?
Okay, so basically, I'm not originally from Tijuana. I was born in a city near Texas, actually. It's called Monclova. And I went to medical school in Monterrey, Mexico, which is, I think, the second biggest city in the country. I went there for medical school for my residency programs. I'm a general surgeon as well as a plastic surgeon, and I did a fellowship in aesthetic surgery. I was there for the whole medical school thing. It was around 15 years. So people that think that this is really fast and easy, it's not. Okay. Um, so I'm originally from over there. I came here to Tijuana. I came here 4 years ago already. I started working with you guys around 3 years ago, I think. Um, and I I had already met Dr. Lassos. We are very good friends. So when there was an opportunity to fill a space and to have another surgeon for the company, he invited me, and I gladly say yes. Um,
And that's amazing because you are a perfect fit. And it's funny because you say you've been a surgeon for 15 years, and I think people, because you guys all look so young, people think, oh, there's no way that you guys have been doing it for that long. But kudos to you for doing it that long and looking so youthful.
Thank you very much. I mean, we all have our small tricks. I'm due for Botox, or something, but I have good genetics, thankfully. I think my both my parents, they look younger than what they actually are, so it helps. It helps, but going through medical school, it makes you um lose some years.
Well, I
So
bet it's quite stressful. So luckily, you guys are plastic surgeons. You do know all the tricks.
yeah, and it's an actual a funny story. I have a beard, but I started using it because when I came out of plastic surgery, a lot of patients were telling me, "Do you actually know what you're doing because you
Right.
look so young?"
Uh-huh.
So that's why I have a beard. If people want to know,
I
it's
love
because it
it.
makes me look older.
I love that. How old are you, if you don't mind us asking?
I'm almost 39 years old.
That's amazing. That's awesome. But also, Dr. Rios, I haven't seen you in a minute, but congratulations because you're a first-time dad.
Oh, yeah, thank you very much. It's been
How's being a dad? How's that? And happy Father's Day, by the way.
Oh, thank you very much. Well, it's been amazing. I love it. Whatever I do it for my family. Um, it takes a lot of time, to be honest. But when I'm done with surgery consultations and everything, I just like to go home and be with my baby. She's 5 months
Oh,
old now.
she's
Uh,
beautiful too.
Thank you
She's
very much. And
gorgeous.
she loves to be in the arms. She doesn't be put in bed or in the crib. So we're definitely enjoying her. Uh, and my wife is doing most of the work right now. She used to help me a lot more, but right now she's staying at home. And I appreciate that because that gives me the peace of mind to actually do what I do, and I can stay a little bit more relaxed about that she's being take care
Right.
of. Mm.
And so your wife helps you. When you say helps you, that's with surgery? What does your wife do?
Well, she used to help me a lot more. We basically started by herself when I came here to Tijuana. And she used to help me with all the administration, answering patients, helping with the photos and stuff like that. She's also a doctor.
Oh, of
She's
course.
yeah, she knows, uh, the life basically. That's why we're still married, because she understands what I do,
I
and she's
love that.
very, very, understanding basically.
That's amazing. Well, it's a perfect pairing, perfect,
Yeah.
partnership, and so congratulations.
Thank you, thank you. And right now, she still helps here and there, but she's mostly, with the baby. So, I can just go home and just, wind down and be happy with them for a few hours before I go to sleep, basically.
That's amazing, but I bet that being a mom is probably her hardest job, no doubt. Yeah,
Definitely,
yeah,
definitely.
yeah, no doubt. Okay, so what made you wanna become a plastic surgeon?
Okay, so my father is actually an orthopedic surgeon. And when I was young, I would see what he did and I would see the relationship he had with his patients. And he was, Monclova, where I was born, is a really small town. So a lot of people know each other. And I would see a lot of people that I knew and how they would talk about him and how he was respected and how people appreciated what he did. And I really liked that. So I wanted to go into medical school and into a surgical field, and I wanted to do something similar to what he did, but not exactly the same. Not be in a way under his shadow. So in orthopedic surgery, as you may know, they do a lot of trauma and fractures and uh, uh, this all of this bones and muscle surgery, basically. So, when I saw that plastic surgery included hand surgery, that's what I was originally gonna do. I went into plastic surgery thinking about being a hand surgeon.
Oh, wow.
Yeah, and, when I got into, the residency program, we had a lot of hand cases, um, but the resources we had weren't the best in a way. We were in a public hospital, so we didn't have all the plates and the screws and stuff like that. So I did a lot of hand surgery, but I didn't love the results because I didn't have the best tools. So I started going into other areas, and I finally had some rotations. I came here to Tijuana, and I worked with a lot of different great surgeons. One of them was Dr. Lazos, but other great surgeons as well. And they did a lot of post massive weight loss surgery. And I did this when I was still a resident in plastic surgery. And I really liked, the what they were doing, the kind of patients they had, and what they could get back to patients. And I think I just fell in love with this kind of surgery.
That's amazing because I can imagine it's very hard to do, but it's gotta be so mentally rewarding as well, and your patients aren't coming to you, like, from a trauma aspect, they're coming to you from, it's elective, this is something we wanna do, and you're just kind of, like, putting the cherry on top of everyone's hard work. So that's gotta be it's almost instant gratification as well because you get to see the masterpiece, you get to create the masterpiece.
Yeah.
But it's gotta feel so rewarding to know that you're changing so many people's lives, and they're already coming to you in like such a good spirit?
Hmm.
Yeah, that's gonna
I
be
mean,
good.
I think we're very blessed because patients from EOC basically they are like a family to themselves. This is a very big group where they share the ups and downs. They share the good and the bad, and it's very realistic. So when you get the patient here, they already know a lot about what to expect, what is realistic, in most cases, and you see them and they appreciate what they're doing, and they're here because they want to improve themselves in a way, right? They did a lot of the hard work, be it through surgery, be it through exercise, medication, and now they want to improve that final part where they can feel better about themselves, where they can um, maybe retake some of that life back, and that's where we come into. We That's the part we play basically.
Yeah.
And it's very rewarding, as you say, seeing what you can do when you see some cases and you're like, okay, this is going to be a challenge, but it in a nice way. You're going to try to do the best with their body frames, their genetics, their skin quality, and everything. And most of our patients, they're very down to earth. They understand what we do, and we get really, really amazing cases with patients, really amazing results. That, yeah, it's. I'm always very happy when I finish a case and I see the final result, and I know that the patient is gonna, be very happy with that.
Yeah, you're like, "I can't wait till she wakes up to see her body."
Yes, basically.
Exactly. So you're basically an artist. So in saying that, if you weren't a plastic surgeon, what do you think you would be? But it kinda sounds like surgeon is in your DNA.
Yeah, so, my father was a surgeon, but this is, I don't know if you would have guessed it, but when I was going into medical school, initially, I was thinking about doing a, computer engineering major or going into medical school. And, when I told my father, he was initially like, "Choose what you want." I think medicine is more, um, like, challenging in a way, because he knew, medical school is kind of tough here. Maybe you've heard about everything that happens in medical school or residency programs, but it's really tough, you know?
Yeah, it's very different than what they have to go through here in the USA.
Yes,
Yeah.
yes. Absolutely. So when I told him, and he was like, "Okay, if you are going into medical school, I want you to be sure." And my brother, he initially wanted to go into medical school. He went into economy, and then he did an MBA and stuff. But initially, he took us each to the OR with him one day.
That's awesome.
Yeah, and when my brother went there, he was like, "No, I don't like it." It was kind of boring for him in a way. Um, and I'm a little bit more stubborn, so when I saw what he was doing, um, I just liked it. And when he came out, he told me, "What do you think?" And I was like, "I'm gonna be a surgeon." So
Nice. You
yeah.
knew it from then on. How old were you when you knew that?
Well, when I started saying I wanted to be actually a plastic surgeon, I was around, um, I think middle school or elementary school.
That's so
I didn't
cool.
know what it and you know what it was about completely, but because of I was seeing my father, I was like, I want this. And when I finally understood it and the complexity of it, I was just, more sure that I wanted to do it.
Oh, I love that. Dr. Rose, I'm 40 and I still don't know what I want to be when I grow up.
You're not 40. What are you talking about? You don't look 40.
Thanks. I know some plastic surgeons.
Well, that's great. That's great.
Yeah, thank you guys. Um, so let's get into the plastic surgery side of things. So when patients come to you, I know everyone's kind of we have a streamlined process, but can you explain when patients come to you, what is the process from say the first consultation to once they arrive and get there and how do you do things?
Okay, so basically, a patient will reach the team, coordination team. In my case, is Haley.
Mhm.
And then, they go back and forth, they get sent a questionnaire that they fill out, and that then gets sent to me. Um, Again, we have a lot of work, thankfully. So when we have some free time, we just work over the questionnaires we get. We see the photos. And then, for example, if I have all the information that I want, I will get back to Haley with a surgical plan that I recommend. In some cases, if they have any other conditions, illnesses, or a specific um, item in the questionnaire that I want to inquire a little bit more about, I just say, Haley, can you ask her or him about this or that? I just need more information to know if it's going to be a good case if we can do a safe surgery basically for them, or if we can achieve the goals they have with surgery, because that's also important to know. It's not only saying, I want this and I want that, and this is the result I want. It's, can that be achieved in your case? And with the surgery you want to get done, right? As a lot of patients may know, we need to split surgeries so they are not as big, and they can be safer for them, and they can recover better from them, basically, right?
Mhm. And
So
I love that because you guys aren't just saying yes, 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 yesing people, and then when they get there, be like, "Well, we can't really do that." So I love that you guys take the time in advance to be like, "Hey, we can do this, but, like, be realistic with things." I love that.
yeah, no, thank you, and I think that's a part that maybe a lot of people don't understand because we are humans. We stress, we don't sleep if we have issues. I know we're not there in your shoes, but it affects us. So we definitely want to do the best surgery we can, the safest surgery we can in every case, because we want you to have the best experience and the best recovery process. And that's what we do with the questionnaire. You need to be very honest because if there is something that a lot of patients say, like, I'm not going to share this because they may cancel me or not do my surgery. Well, that's actually a good thing for you because there are a lot of surgeons that may take you and put you at risk, and you may have a really good result, but are you going to enjoy that if you have stroke or a heart attack or a renal failure or something else, right? So we need to make sure that we're going to do everything in the best possible way for you, and that includes considering everything that you share with us.
Mhm.
Okay.
Yeah.
So we go over the questionnaire. I send my recommendations back, and then the patient goes back and forth with the coordinating team. Um, and then they know they have our schedules. They look into dates, and the patient chooses a date. And then between then and the date, they go over all the logistics of payments and stuff. So I see the patient the next time, one day before surgery, usually, unless it's a Monday.
Mhm.
So if it's a Monday, I'll see you the same day, but I'll take my time. I'll actually start the surgery a little bit later because I'm not going to rush things. So I'm going to sit there with you. We're going to talk about the surgery that we're planning to do that day. We're going to go over the blood work that you had done 1 or 2 days before when you arrived here in Tijuana. And that's another thing that we also do. Between the assessment and the surgery, we usually ask for blood work from home because there are many cases where you may have low hemoglobin or a thyroid issue or diabetes that is not well controlled or hypertension. And we want to know how you're doing before surgery so you don't come here and we need to cancel or defer your surgery, right? We
Mhm.
know that it's time that you're taking from work, from your family, so we don't want you to come here and say like, hey, we need to move your surgery 2 or 3 months, or we cannot do your surgery because of this thing that we could have found out.
A month ago, yeah.
So basically, when all that's said and done, you're here. We check your blood work, and then we do photos and markings. You know, I see everything in person. You tell me your goals with surgery. We talk about if it's realistic or not. Um, I assess the quality of your skin that day. I see how much it stretches, how much it moves. If we need to add procedures because the skin is a lot more loose than I thought from photos, or maybe it's not as loose, and then we can remove, I don't know, a torsoplasty, or instead of belt tummy tuck, we do an extended.
Gotcha.
Um, and we talk about the goals with surgery, what we're going to be doing that day. I do the markings. And then if that's a Monday, you're going to go to the OR. If it's another day, you go back to the hotel, you get some rest, and then I see you the next day for surgery. Okay. Then, the day of surgery, usually if I saw you a day before, I will still see you that day because I want you to know I'm there.
Yeah.
Mm.
It
I
makes
also
sense.
want, yeah, right. Some people say like, hey, did the surgeon do my surgery because I see him before surgery, but we're always there. Um, so I come in and say hi, and we go over any questions that maybe we didn't solve the day before because you forgot them or something, right?
Mhm.
Um, I'm very my father, he taught me this basically, but I'm an early bird. Get there around 6:30 a.m. I wake up around 5:40 a.m.
Goodness.
Some of my fellow surgeons, they go to the gym and stuff, but I I don't do it, and especially not now with the baby,
With the
right?
baby, okay. Yeah, if you do,
Um,
you're basically not sleeping ever.
exactly. And I want to be rested for you, for patients, right? So I go there, we go over any last minute questions, we prep the OR, we bring you in, I do the surgery, and when I'm done with surgery, I'll either go talk to your relative or I'll call them and let them know how everything went. The patient stays 2 to 3 hours in our recovery unit and then is taken to the room. They rest there for the remainder of the day, and I see you the next day in the morning. Check the incisions, see how you spent the night. We do a control hemoglobin check just to make sure everything's good. And then I deliver the girdles that you're going to be using for the, um, for the healing process or the post-op process. Then they usually stay around a week in the city, and I see them one day before they go back home just to go over any questions from traveling, post-op concerns, check the incisions, we take photos, and they travel back home. We're still in touch through the coordinators, and then they can send us their questions, their photos, um, concerns, and we could go over them as soon as possible, basically.
I love it. And so can you just give us a few, let's just say like your top 3 tips for a successful recovery? Because plastic surgery recovery is huge. I feel like you guys do an incredible job, but then it's up to the patient to then it's our job, you guys. It is our job to make sure we honor their work. So what would you say are like 3 really good recovery tips?
Okay, so let me think. But yes, you're correct about that. So I tell my patients that this is 50-50. I can do the best surgery in the world, and if you don't take care of yourself or you have poor genetics, do you smoke, you take some medications, you have uncontrolled illnesses, maybe it's not going to be the best result. And the other way is true. If we don't do the best surgery, but you take super great care of yourself, you may still get good results. So if we put these two together, you're going to have an amazing result that is going to be way beyond what we did in the OR. But the three tips that I would recommend is one, resting enough. Okay. We definitely want you moving around, but not too soon and not too much. So the first 3 weeks, I think, are very, very important in the recovery process, because if you overdo it, then you're gonna see the consequences later with openings, or the recovery process is gonna be tougher for you. There's gonna be more pain, more swelling. So the first 3 weeks, resting is really, really important, especially for the surgeries we usually do, like the big skin resections, the tummy tuck, the thigh lifts, the breast lift, etc. Right? Two, um, eat and drink enough. So you need to recover the nutrients your body needs to build everything back up. So we removed a lot of fat, we remove a lot of skin, but then everything is separated and repositioned. And then if you want to rebuild those tissues, you need a lot of proteins. You need those building blocks to build that scar tissue. So proteins is very important. And then carbs, but not simple carbs, not sugars or something, or like starches or fruits, vegetables, because you need a lot of energy. Your body needs a lot of energy and needs proteins. The fats, the vitamins, minerals, they're also very important. But the two main things is proteins and carbs, and drinking enough fluids, because we need you to be hydrated. We need you to have good circulating volume so the blood can get everywhere it needs to be and help your body recover, right? And the third one is listen to the recommendations we'll give you. A lot of people think that this is a recipe. We always do the same surgery for everyone. We always do the same post-op care. And mostly it's true to a point, but there are a lot of things we do different in every case. Stitch placement, amount of stitches we do, amount of liposuction, just the patient we're dealing with, they're very different. So we don't treat the openings the same way if it happens in the first few days or if it happens 4 weeks out. We don't treat a little bit of redness around the incisions the same way as spreading redness, or we don't treat the same thing like a fever is treated differently than uh, um, pain. We have different ways of dealing with everything, and that is very, very tailored to each patient. It may seem that we always recommend similar things, but it's not true in every case. So if you have any questions, concerns, just, send them our way and we're going to let you know what we think is best for you. And this is true for everyone because you can go to a friend that had the same surgery. You can go to a friend that is a nurse or a doctor, and they'll tell you something that may not be the best for you.
Mhm. Exactly, and I think that's why, a lot of the time and it's a big thing on the Facebook support page, we always say, "Don't ask for medical advice, and please don't give medical advice on the Facebook support group because it's not a one size fits all." So you definitely have to go through your coordinator if you have any kind of medical questions because you need to get it straight from the surgeon himself because he knows your case.
Yes,
Mm.
exactly. So we know what happened, and that's another thing. We sometimes see in the support group patients that even recommend things that are specifically said not to be done. Like, oh, I went and I had a bath at 1 week out, or I did exercise at 3 weeks, um and it's good that you did it and nothing happened. That's amazing
You
for you,
got
and I'm
lucky.
very happy.
Yeah.
But if somebody else does it,
Mhm.
maybe they're gonna have really bad complications, and that's what we don't want. We want to have like, we want to err on the side of caution.
Now, speaking of the Facebook support group, I took to the support group. Now, we love the Facebook support group. We love everyone there. Everyone's very helpful. So I took to the support page because people love you there. And you guys post your results every day. And every time I see your results, I'm just even more and more in awe every time I see your results because you are pumping out some amazing hourglasses lately. Let me just say that.
Thank you. Thank
A-
you very much. I
and
mean, we always work with you as a patient
yeah.
with the frames that
Yeah.
you have, but we always try our best, to get the best results we can. Yes.
You
Thank you.
do, but I do notice that a lot of people are loving you. So I took to the Facebook group and I said, "Hey, Dr. Rios is going to be on the podcast. Give me your questions." So I have a ton of questions. Are you ready to go through them?
Okay.
All right,
Yeah,
let's do
ready?
it. Okay, so Marsha Johnson, she has a list of questions. So we're just going to take it from the top from Marsha. Okay,
Okay.
she wants to know what is your favorite surgery to perform.
Okay, I think my favorite surgery, maybe tied in number one, is arm lifts and the belts or the tummy tucks, basically.
Interesting. Why?
Well, I think the way I measure things and the way I can release the skin and pull it and achieve the lines that I want is in my head easier for me. It makes more sense in that way. And it's not that the other surgeries don't make sense,
Mm-hmm.
don't take it the wrong
No,
way.
no, no, but yeah,
Um,
I understand that.
but yeah, I think, the thighs, they're obviously a lot more volume. And then the breast is a really complex surgery. I don't think a lot of people understand what we do when we're in the OR.
Mhm.
Breast is one of the most complex surgeries that we do in body contouring. Um, so I definitely appreciate the challenges. It's always nice to see something new. I think if you always do the same surgery, the same type of patient, maybe you can get the best results. And but it's gonna be monotone. It's maybe gonna be boring. So getting new challenges is nice. Um, but those two surgeries speak to me the most. I think that's where I can move things around and say like, yeah, this goes here and I can remove this amount of skin and it
Yeah.
feels good.
I love that, I love that. Well, that kinda leads me to the next question. You kind of just answered it, but what is the hardest surgery for you to perform?
Yeah, no, definitely hands down is the breast lift.
Yeah.
We try to do a surgery while moving very, very important structures around, but still keeping them alive. And it's very different moving an areola nipple 1 centimeter up or half an inch and moving it 4 inches up. And then,
From your belly button to your shoulders, ladies, we all know.
yes,
Yeah.
no, it's hard to plan that, but then it's harder to achieve it and still keep everything where you want it to be. We want to achieve symmetry, but we still want to achieve healthy tissues. We want to keep them alive. We want to keep the skin as tight as possible. And then we're dealing with skin that is not the best in quality. It's been damaged over time. Sometimes it's very loose, sometimes it's not as elastic. Sometimes we have really good blood supply, sometimes we don't. Have patients that maybe smoked or, it's just their bodies. Sometimes we use implants, sometimes we use fat. So sometimes we don't do any of those. So it's very, very different. And the shapes, the body shapes, the position of the areolas, the way we need to move them around, but still keeping them alive, that is what's challenging about it. And it's very enjoyable, but it's definitely the hardest.
Oh, it's gotta be the hardest because it's not just, like, one line and one line that meet, like, it's a few different lines that you go, "Okay, that needs to go there, then that needs to come up, and then that." So, yeah, so by trade, I'm a seamstress, so when I see you guys mark us up, I'm like I look at the seams, and I'm like, "Oh, wow, that's whoa," so I can only imagine. I would
You
hate to
can
sew
always
the pattern of a breast lift.
you can always come here and help us out.
Well, let me know, maybe that's what I wanna be when I grow up.
Maybe,
You
yes.
you never know, but that would be cool. And then Marsha also wants to know, do you know how many mummy makeovers you have performed?
Wow. Okay, so I'm very bad at statistics.
Me too.
But if I had to guess, I've done over, I think, 800 of them.
Wow.
Just thinking of it. We normally perform over 200 surgeries a year. So if I just think into that, and I've been here over 4 years, and I worked for 2 years in Monterrey, Mexico, before I came to Tijuana. So I could say easily over 800, I think.
That's pretty cool. She also wants to know, do you have a most memorable patient? Someone that's just stuck out in your memory?
Oh my God, that is a tough question because we always have this, like, good memories, bad memories, patients that stick with you. Um, there are definitely, I think there's one case that I can think of. I was thinking of a few, but um, I had a patient that we did her surgery. Everything was very, very nice. She was going great. And this is kind of like a bittersweet memory because after a few days from surgery, she had some complications not related to my surgery.
Mhm.
She had weight loss surgery before, and then she ended up having issues with that surgery. She actually had uh, uh, the intestines. They blocked. They were, it's called intussusception, and one of the intestines go into itself, so it blocks everything. Um, she was in pain. It wasn't anything to do with our surgery, so it was kind of challenging to diagnose her. But I saw her, and we took her to get a CT scan and stuff, and we found that out, and she actually had help from Dr. Elias Ortiz,
Oh,
actually.
it's amazing.
Um, and he did her surgery. He helped her, and so she had 2 surgeries while she was here, but then she could recover from both. And I think I really liked that because I'm also a general surgeon. So I could diagnose her and I could get somebody to treat her for what she needed. And it could have been really bad if it was something that wasn't caught in time. Because I don't know if you may know, but if that stays like that for hours, it may complicate, and it could be a really bad complication. So she was still here. We did everything we could, and she recovered very well. And actually, I'm gonna see her soon. She's gonna come back for her round 2. And I always remember her fondly because um, I'm very happy that we could help her, and maybe this had happened on another setting, it could have been a very different outcome, I think.
100%. You guys saved her life.
Well,
I
I
would
I
I
think
would
so,
think so.
yes.
I would 100% think so because imagine if she just went to a regular plastic surgeon out here that isn't a general surgeon or, especially because it's in the same area, the
Mhm.
stomach. So
Yeah.
people would just probably dismiss her like, "Oh, it's just surgery pain," or so, but the fact that you didn't and you dug deep and you dived deeper and you found it out. Not only that, she's in the best place because then you handed her over to Dr. Ortiz and was like, "Hey, can you fix this?" And, like, he's, like, one of the best bariatric surgeons in the world, so oh, yeah, she definitely had, some angels watching over her and sent her to you guys for a reason because that happened at the right time, so unfortunate but fortunate, yeah.
Yeah, no, and I'm very thankful, for the support we got, and it's a blessing to have the general surgery part of the company because maybe we would have struggled to find another surgeon on an urgent basis because all of this was done in one day.
Oh, wow.
Happened in one day. She was having some issues, but there was one day where everything just um, got bad in some way,
Mhm.
and then we could do everything that she needed that day because everybody was available.
I love that.
Everybody was open to help her.
That's amazing. I love that. That's what I love about you. See, and you know what? Like being in the States, a lot Mexico gets a bad rap. People are like, don't go to Mexico. But no, you guys go to Mexico because look, where else in the world does this happen? Like where you guys are like, look, it's okay, this has happened, but we've got you over here with our other team. That'll never happen here in the States or even in Australia where I'm from. So kudos to you guys. Now looping back to the breast, we've got a question from Miranda Debbie. And it's interesting because you said sometimes we do implants, sometimes we don't, and she's torn. She said, "I'm torn between implants and fat transfer." She's seen a lot of talk about that lately in the Facebook support group. How do you handle that, and how do you help a patient to choose what's best for them?
Okay, so we have some important differences between both. Okay, so implants is it's always going to give you a nice result, a nice shape. Obviously, we have different shapes of implants. We have the round shape, we have the anatomic or teardrop shape. We have like kind of the ergonomics that can shift between both. But what happens is when you have a 300 cc's implant that is round, it's always going to be 300 cc's round, and it's always going to have that projection if it's a high profile or if it's a moderate profile or something. So it's very stable. It's always going to give us that nice round shape in the breast or the chest, right? Fat transfer doesn't behave that way. We can inject it to create that shape, but in the end, fat is a fluid.
Yeah.
You know, it it's gonna accommodate differently over time. Most of the times, it doesn't fill the upper pole as much. It goes down to the lower pole, so it gives us a lot more natural results. It can still provide volume increments, but it's not as reliable as an implant. You can inject 300 cc's or milliliters, and then maybe half of that is reabsorbed. Um, so we have pros and cons. Obviously, if an implant is placed, but then it's exposed or it's contaminated by a lot of different things that can happen, you need to remove it. And fat, you can inject it and it's still part of your own tissues. So if it integrates, it's permanent and it's not going to cause any reaction to your body. So we have two procedures that can give us really nice results, but that have different indications. So if there's a patient here that says, I really want a fake look and I want to have,
I said that.
oh, okay. Well, you want a fake look and you want that roundness, that upper pole, that cleavage, you have to get an implant.
Yeah.
There's no way we can achieve that with just fat transfer. If you have a patient that says, "Oh, I don't want to have any kind of reaction. I don't want it to be the most natural thing that you can get, but I still want to, maybe the lift or the procedure I'm getting is not going to give me the volume I want. Well, we can do a fat transfer. It's still going to be an improvement, but it's not going to be the same improvement, right? So I see my patient and I see what their goals are with surgery. And if they don't know what they're doing, that's the kind of questions I ask. So you want more fake look, you want 2 cup increment, um, or, and this is very important, we see patients with different quality of tissues. If we have a very dense breast, using an implant or a big implant, it puts you at a super or a very high risk of complications regarding blood flow to the areolas and nipples or openings of the incisions. So that's another thing. If I see that you're very young, you have a very dense breast, you have a tubular breast, and you want to be very big, but you want that lift, maybe we're going to talk about, okay, if you want an implant, we can do it on a second stage. Or maybe just do fat because it's a little bit safer in that sense. We are not putting a lot of pressure. I can only inject what fits. So maybe I'm not going to use 400 cc's. Maybe I use 150, and it doesn't increase the pressure or the tension in your breast as much. So all of those things are what I consider. There are definitely patients that don't want either one, and that's perfectly valid. This is not one size fits all. So we always go with your goals with surgery, and we try to steer you in the right direction. Also, something if you're here and you say like, I'm not sure. I've been unsure about implants for months. I want fat, but this friend or my husband said something. I may try to steer you more towards fat transfer or no implants because that's what you thought was best for you.
Mhm.
Obviously, we're going to talk about results and goals with surgery, but if you were sure about something and recently you were like, I don't know what to do, maybe that's what's best for you. And if there's something that goes wrong, you're going to be more at ease because that's what you chose.
Exactly, or you don't wanna regret it, like, "I wish I didn't do the implants. I shoulda went with my gut," that kind of thing.
Exactly. That's why I don't like to steer the patient to what I think is the best for her. Obviously, if she tells me, what do you think? I'm going to say what I think. But I don't want to put my thoughts or goals in her mind.
Yeah, right, because 'cause they're 2 different things. But it also makes sense that it it will determine on what they're working with as well. Because some people think, "Well, I don't want implants," or I do want, this or that," but it's really gonna matter what they come in with. Like you said, if they got more of dense breast tissue, so on and so forth. So, keep that in mind because when people in the Facebook page, they ask, obviously everyone's giving their opinion on what they did or what they wanna do, but again, like, your breast tissue isn't the same as her breast tissue, so it's best to definitely, see what you guys recommend at your pre-op appointment, right?
Exactly. Yeah. And as you said, it's not the same going from an A cup to a double D,
Yeah.
going from a double D that is loose to a double D that is lifted. So, there's a lot of things that we can discuss at the pre op to get you where you want to be.
Yep, that's awesome. Miranda also requested, and I don't think we can do this because I think you're on your computer, but she said, "Can you give us an office tour?" You're in your office now, aren't you?
Yeah, yeah, I'm in my office. Yeah, but I'm in the computer, so it's gonna be hard to move it around. But maybe we can record a video later, and I can share it.
I've never been to your office actually, so next time I'm in TJ, and I was just there 2 days ago, I should have come visit, but it was a whirlwind trip. Next time we'll do an office tour, but let me ask, so behind you, you have, like, lots of little art pieces, but I see an award.
Mhm.
What is
Yeah,
that?
there's a lot of things. So,
That
what is it?
one, that
Oh,
award.
that is
Yeah,
no, that is because of an inversion that I did in a hospital that is being built in Monterey.
very cool.
It's mostly just decorations, but I have some gifts from patients, which if anybody has given me anything, I'm very bad at, doing those stories and thank you. And I'm very sorry. I really appreciate everything that you've given me.
You're not
Uh,
like Dr. Lazarus and you make them open them and he films you.
yeah, no, I know, and I think it's bad on my behalf, but
No. No,
and I'm
you're
trying to be
enjoying the
better.
moment. You're enjoying the moment. That's
Yes,
good, that's
definitely.
good.
I enjoy it a lot more, and I definitely enjoy it. Honestly, I'm being truthful here. But I'm not the ones like, hey, let me show you this, and and
Like
it's
an
not.
unboxing,
I'm
like
not.
an influencer. Let me do an
No.
unboxing.
Yes, I'm trying to be better though.
No, you're doing
Gonna.
actually, I have noticed you on social media a lot more lately, and you're
Oh,
doing very well. I
thank you
like all
very
your
much.
little reels and TikTok things you're doing. And I really like that statue behind you, near your TV. That's like a patient on the table, is that right?
Yeah,
The
so
stick figure one?
this is
That's
something I
cool.
would do, and it's, in theory, it's surgeon, this is supposed to be scalpel, and this is a patient, and, this is the surgeon.
That is
Um,
cool. I like that.
and then this is another gift from another patient. Some people may think I'm crazy because I have a plush here, but
Oh, that's
yeah,
cute.
a lot of people say like, "What is that?" And you know, I explained it to them.
It's my
I'm not.
emotional support ram.
Oh no, it's a goat in
Oh, a
theory.
goat, a goat. Oh, okay, because of the goat, greatest of all time. Is that why?
Yes, that's why.
I get
And I
it.
have, like cups and, uh,
Nice.
you know, different things patients have given me over the years that I've worked. So I have a lot of stuff here everywhere.
That's
Uh,
so nice.
and a lot of my patients know my outside wall where I have my Dr. Andre Rios plastic surgery, my sign and my logo and everything.
I love it. I love it. So there you go. Not a full office tour, but good enough. Next up, we have Cindy Zebelin. She wants to know how soon after a facelift, because I think she just got a facelift, can she have body work done?
Okay, so this is gonna be different for everybody. I think, usually around 3, 4 months we would be good enough to have body surgery. Why is that? Because we want you to recover enough before you put your body through more trauma. When we do a body surgery, it's different because the body surface is a lot bigger. We're
Yep.
working with all your back, your abdomen, your breast. So your body's dealing with one, initially healing everything, closing the gaps, creating that scar tissue. But then that a healing process, it doesn't stop there. And that's why you're going to be swollen for months. That's why the scar is going to have different colors, different thickness. You're going to be undergoing a lot of changes in the first few months to years. So if we do big surgeries back to back, it's gonna put your body into under a lot of stress. And then maybe you're not gonna heal the same way from the second surgery as you heal from the first because you're still healing from the first. Facelift is different because the surface area is smaller, and the face thankfully has a really good blood supply, so it heals a little bit faster.
Mm.
So it's a smaller time frame for that surgery.
That makes sense because when I see these facelift patients and they're like 3 weeks out and they look amazing, and I'm still like wrapped up and bandaged like 9 weeks out, I'm like, what's going on? So that makes sense. So thank you for that. All right. So we have a lot more questions to get through. So I'm going to just blast through them. Oh, Cindy, the same lady, she would like to know how soon after a tummy tuck can she start going to the gym again?
Okay, this is my recommendation, but normally 6 weeks out, you can start doing light exercise. Okay, light exercise is like walking, jogging, swimming, bicycle. Obviously, if you're gonna go into the water like swimming, you need to be healed everywhere. You don't need to have openings or scabs.
Okay. Yep.
And that's 6 weeks for light exercise. In my personal opinion, when we do a muscle repair, I wanted to heal completely before doing heavy exercises. And I normally recommend 3 months until you do heavy core exercises. That is going to put the abdominal muscle into under a lot of strain. Okay. Because this is a very strong muscle. And if you do a really heavy crunch, if you carry a lot of weight, you may hurt the muscle repair.
Mm. That
Okay.
makes sense. Yeah, well, that's thank you for touching on that because yeah, she did say with the muscle repair when can she return to gym. So there we go, 3 months, you guys. Hold off on those. lifting weights for well, with your abs for 3 months. Okay, now we have Brittany Caniff, I guess.
Mhm.
She says, oh, this is a good question too. During pre-op, do you have a preference? Would you prefer inspiration pictures or conversations centered around their expectations?
Okay, if I had to choose one, would be conversation with realistic expectations because I want to see what you want. I want to understand what you want. I want you to put it into words so that I can understand it. But I've had some patients that they're not sure about what they want or they cannot express it in words. Uh, Inspiration pictures definitely help there because I may understand the shape that you want to achieve, the size or volume. Like if you show me a breast augmentation uh, um, surgery from another patient, I can tell you maybe that's not going to be your result. Or maybe if you want that result, we need to do something different. But then I can explain to you why that is a result we can achieve or not,
Yep.
right? So ideally, we can discuss what you want, and I think that's a lot better in my opinion. But inspiration pictures help in some cases.
Okay, cool. She has one more question. She says, "What the heck do I do about my belly piercing?" So she has her belly button pierced. What does she do with that? You got to take it out, obviously, but then what happens to the old belly button?
Okay. So, it's funny because we have a lot of patients that had belly button piercings before. There's not much we can do. When we do the tummy tuck, basically we need to cut that skin and then bring it down and cut the excess away. In a lot of cases, depending on the patient, we can remove that part of the skin and then we bring out the belly button through a new part of the abdominal skin. And then when it heals, some patients they redo it. It's not my personal preference, but it's everybody's is different, right? Um, but sometimes, and you may have seen this, some patients end up with small vertical incisions between the new belly button and the lower incision.
Mhm.
And that is because maybe the skin wasn't elastic enough and we couldn't remove as much skin to remove the previous belly button, uh, uh, the previous skin that was around the belly button. So we reclose that and we end up with a small vertical or a small T.
Mhm.
When you have had a belly button piercing, we need to remove a little bit more skin or we end up with that scar in the lower abdomen and it looks very distinctive in a way.
Right.
So if you have one, yes, you need to remove it for surgery. Maybe it's going to go away. Maybe it's going to stay there just in a different area. If you don't have one, my recommendation is don't get one because
You're like, "Don't ruin my new perfect belly button."
yeah, no, but even before that, a lot of patients they are like, "Oh, I shouldn't have done it." Um, but yeah, I mean, sometimes it makes us create a little bit longer scar.
Yep, that makes sense. Okay, and then we have Jessica O'Daniel. She said, "You perfected her body 2 weeks ago." So,
Definitely, yes. Yeah, I remember her, really nice patient. I've seen her posts and she's healing great. So
she looks amazing.
hello, Jessica. I don't know if you're seeing this,
Yeah.
but keep up the good work, keep resting and taking care of yourself. And, that's going to give you really, really amazing results, which she's already on the path of getting them.
Yeah, so stay on that path, Jessica. But she has some just really quick personal questions. She wants to know, what's your favorite band or musical artist?
Wow. Okay. So I don't know if this will shock some people, but I really like heavy rock or something like that.
That's
Uh,
That's shocking.
so my favorite band at the moment, it's I would say Avenged Sevenfold. I don't know if you know that band.
I don't.
No?
I
Okay.
don't know.
So
I'm like a Barbie girl. I don't know.
okay. I like heavy rock, but I don't like all the like screaming only and stuff.
Gotcha. Yeah,
Like
yeah, yeah.
I want them to actually have a singing voice.
Mhm.
So, Avenged Sevenfold, I like Disturbed, I like Slipknot a little bit.
So
My favorite
Haley is perfect for your coordinator because that's all her kind of music too.
I know, I
Yeah.
we have talked about it before.
You guys have gotta take a trip out to Vegas to do the, When We Were Young concert. There's, like, every alternative rock band. It's like it's a 3-day weekend, and
Wow.
every like, Blink-182, everyone's there, like, every year, and it's I actually live in the building right across from that event ground, so I get a free, 3-day concert that weekend. But you guys should definitely check it out. You'd love it.
Yeah, I'll definitely look into that. When my baby's a little bit older, I'll definitely look into that. But yeah, I would love to go to all these concerts right now. I've gone to some like Corn.
Oh, yeah,
Um,
see, they're out there too.
yeah,
Yeah,
so
all the, um, icons.
Rammstein, I've also seen them and stuff like that. So it's
That's
uh,
I would have not picked you for a alternative.
yeah,
I
no,
don't
I know,
know.
I know. It's a shock to a
I'd
lot.
probably think country, if anything.
Really?
I
Wow.
don't know, I think
We
maybe.
do listen to a lot of different music in the
Yeah.
OR, you
Okay,
know,
yeah.
because it would be tiring to just do one musical genre.
Yeah.
So we do country, we do pop, we do like old music. We all, I think, like bands that our parents heard when we were younger. So we hear a lot about that. Obviously, reggaeton and stuff like that.
Yeah.
That is a lot.
I enjoy that, that's pretty cool.
A lot of people like it right now.
And then we have Linda Michelle Stella. She's coming to see you in November and she's so excited. And she would like to know what other services slash add-ons like injectables can she get?
Okay, so here what I also provide is obviously Botox or dye sport. For dynamic wrinkles, we do fillers. I do temporary fillers and permanent fillers, like fat fillers. um and then I also have Morpheus 8, which is treatment that we can improve certain areas. It's a microneedling technique with a radio frequency that we can use in the face, the neck, cleavage, a lot of different parts of the body to tighten the skin. Uh, I also have body tight, face tight, and I also have Vaser and J plasma. So there are a lot of things that we can do. There are a lot of different filler options. Um, Obviously, it's not for everybody. Not everybody's going to benefit from each. Not everybody would need fillers or Morpheus or body tide. Maybe they need skin resection procedures. Maybe they need a facelift. So it's always important to do an evaluation. Um, but yeah, we have all these different options that you can look into and you can ask about.
And can they add them in at their pre-op or post-op?
Okay, normally if they are doing fillers or morphosate or something like that, which is a little bit more invasive and more painful, then I would rather know before surgery because a lot of these things we can do while you're under anesthesia. And
Mm.
it's not going to bother you. You're not going to suffer from them.
Oh,
Um,
that's so good. Like,
yes.
if anyone's thinking about getting their lips done, do it while you're knocked out because that hurts like a son of a gun.
You know, I started doing lip fillers back in the day, and then all my post procedure photos, they had like the Rimmel or the eyeliner. It
Yeah,
was like running down their
running.
cheeks. So I
Yes.
was like, this is not good publicity, right? Marketing. So I started doing like blocks,
Yeah.
lidocaine or
Oh.
during surgery, so it's not as painful, and they can maybe not enjoy it, but it's not going to be
Yeah, it's not gonna be
something they
brutal.
saw.
Do you do the fat transfer into the lips?
Yes, yes, I
Oh,
do that
very
as
cool.
well, and that it has to be done during surgery because one, we need to get the fat. Two, we need to be in a sterile and really clean area with special cannulas and stuff like that. So, in my opinion, my personal opinion, it has to be done while you're in an OR.
Yep. Ladies, I recommend anybody adding that onto their procedure. Like, while you're already there and you're getting the fat sucked out anyways, just use a little bit, put it in your lips, and beautiful. Chef's kiss, that's what I would be doing. Because even with the numbing cream, that still does you can still feel it through the numbing cream. Like,
Yeah,
they
I know,
hurt.
right?
They hurt. Okay, let me just say, I think we're coming pretty much to the end. Let me see. Yeah, Dr. Rios, we've got through everything because some of the questions that people asked, we already touched on them earlier on in the piece. So I think that's it. Is there anything else you want to add to advice or anything you want to tell anybody ready to come for surgery with you?
Well, not anything in particular. I think it's very, I love that the patients are a lot more informed these days because this is something that is fairly new that you see the patient here and then, they don't ask a lot of questions, but not because I don't like questions. It's because they already know what to expect in many different areas, right? So obviously get informed, obviously follow your surgeon, whoever it is, and ask them any questions you have. There is not a bad question. There is not something that we would think like, oh, come on, that bad question, right? Anything is valid, and you're not the expert here. So if you have any questions, then send them our way. Maybe it's something that is very simple, or is something that is very complex that we can go through, or we can go over about what to expect or what happens during surgery or after surgery, right? So definitely just be informed, follow us, ask us what you want, and make sure that the surgeon that you pick resonates with you, that you see him or her and it's like, okay, I can trust him because the easy part is before surgery. The easy part where you're not in the OR, you're not healing, you're not having all these thoughts and the swelling and the incisions and all these things that come after surgery. So you need to be able to trust what we're gonna recommend for you afterwards. And if you don't trust us enough for that, maybe you need to take a little bit extra time to make sure you're there, um, or just see that you're gonna be 100% into the process, basically.
I love it. You heard the man, you trust the man, he is the man, Dr. Rios, the number one plastic surgeon here in Tijuana, Mexico. Thank you for joining us on the podcast today.
Oh, thank you very much for inviting me. And it's always nice to talk about these topics and to have people be a little bit more informed. So definitely whenever you want to have me, I'll be glad to be here.
There you go. Thank you so much.